First of all, let me just expand on what really is convalescent plasma. So whenever somebody gets an infection, the body tends to try and mount a response to fight off the infection. And it does so by creating their own soldiers. We call them antibodies. So when it comes to convalescent plasma and its use in fighting COVID-19 infection, what we try to do is to identify patients who have had COVID-19 and have recovered, and knowing what we know about patients' immune reaction, we assume that these patients who are recovered have enough of these antibodies in their blood. And so we then take that, process it, and give it to other patients who have COVID-19 infection but are probably not doing so well. So there are specific criteria that are used in selecting patients for donor as well as selecting patients for recipient. And this is all an informed consent-driven process where patients are counseled before they actually donate or before they receive the convalescent plasma, which is a blood product. We actually started about 2 months ago, and so far we have had 4 patients who have received the transfusion. But we have been lucky and we are blessed with a very generous population of patients who are willing to help each other. So we have had a very good result and response from patients when we ask them to donate their blood plasma when they recover from this condition. And so far we have had very good high response, favorable rates for donation. We've had 4 patients who received the convalescent plasma. 3 of them are alive and doing well. Unfortunately, the very first patient did not survive, but it was used in a time when there was nothing else to be done, and we use it on what we call a compassionate basis. Patient is extremely sick, we don't have anything else to offer, and we decided to try this. Same thing that applies to any blood donation. Once the patient is recovered, there's a certain number of days beyond which, we want the patient to be symptom-free, and then we ask them to donate their blood, make sure they don't have any other infectious diseases that can transmit from one person to the other. And it's a very straightforward procedure. The blood, when it's taken, is also screened and for any kind of adverse particles or infection that can be transmitted from one person to the other. So it goes through a very strict and rigorous process of confirmation that this is suitable to be transfused from one person to the other. So right now we don't have anyone who's actively receiving convalescent plasma. The protocol dictates that the one that we use, actually, we give 2 units of convalescent plasma, and we make the assumption that within those 2 units they have enough transfused antibodies to fight off the infection that they have. We don't have anyone currently, as of this week I believe, who would have received the convalescent plasma. In terms of the age, so far we have not had to transfuse any patient below, who are not adults. So Georgetown Hospital is the premier healthcare institution in Guyana, as we all know. And so we have been the lead in using this technology and this treatment option for patients. And so we have only been able to use it in quite sick patients. And yes, they would have met criteria to be admitted in the ICU, and those are the types of patients that have recovered. I'm not aware of a requirement for permission to treat patients if you think it's going to make them better. But it is always nice to have whatever therapy you're using to be approved by the relevant authorities. I know for a fact that now it is approved by PAHO and WHO as a viable means of treatment. And of course, our Ministry of Health, our Ministry of Public Health in Guyana, is also on board with this therapy.